If you've tried everything to treat your chronic pain, migraines, I get them the worst, depression, or even PTSD, and nothing has worked, well, there's a new revolutionary treatment that may provide relief. It's ketamine. Dr. Moran and Dr. Renaud Rodrigue, they join me from Kalypso Wellness Center to tell us more about it. Good morning and welcome.
Thank you very much.
Okay, well, actually, Dr. Mark, let's talk with you first. You're one of the founders. What is Kalypso Wellness Center?
Well, the founders and I really were frustrated with dealing with patients with chronic pain that weren't getting better. So we decided to take an old medicine in an innovative new way and start ketamine infusion centers where we can treat depression, PTSD, fibromyalgia, arthritis, nerve pain, many different disease states with great results.
Okay, now Dr. Renaud, this is huge because Time Magazine featured ketamine last month on the cover. Okay, whenever I asked him this earlier, he said, okay, what in the world is it? Now, a lot of people don't know.
Right. It's been around a long time. The drug has been around 50 years. It's an anesthetic. It's been used on multiple different fronts for burn patients, as a general anesthetic for various other issues, and now has found a niche for the treatment of these different syndromes, and it's just been a remarkable new discovery.
Now, how is it actually helping these treatments that I mentioned earlier? Depression, I get the worst migraines, even PTSD.
I always like to explain it like a cell phone that gets locked up. So you have lots of apps on your cell phone you're dealing with, and it kind of freezes.
Okay.
You have to reset your cell phone. That's how ketamine works. It clears nerve pathways and helps nerves regrow and reset their nerve pathways to help them heal. So ketamine helps nerves regrow and heal.
How is it given to patients? Is it a pill?
Intravenously. Over 45 minutes to an hour with very careful monitoring, not because it's dangerous, it's a safe drug, but we want to watch them and make sure that they're getting the appropriate response.
And at what point would we know that this is a route to take if maybe we are suffering from some of these conditions?
Well, we're looking for patients who are really still having problems with their treatment options. So we want to help current physicians and therapists with their patients by giving this as an adjuvant to their patients. So anyone who's really suffering from chronic pain or depression or PTSD and not really getting the benefits that they're looking for, this is a great option for them.
It sounds like a great option, but is it a safe option?
Very safe. And just let me back up for a second. PTSD is post-traumatic stress disorder, and we have remarkable effects with those patients, but it's a very safe drug. Minimal to no side effects, really. It's a general anesthetic, so it's been, like I said, been around for a long time, very well tolerated by the patients.
Speaking of patients, how have your patients, what kind of feedback are you getting from them?
The patients love it. We have hundreds of testimonials about the benefits of patients, how it's really salvaging their lives and they're getting their lives back. But the one story I really like to tell is about, we had a Vietnam vet who had PTSD nightmares for 40 years since Vietnam. He was unable to sleep. And he got one infusion about 10 months ago and hasn't had any nightmares since then. So the quality of his life is much better because he can simply sleep now.
I can only imagine. I'm sure he's so grateful for you for that also, to sleep peacefully and not worry about those nightmares anymore. But well, talk to me about the future here. What is the future for these for this therapy?
I think we're just beginning to scratch the surface here. This is so new, and we're seeing such remarkable results. I think we're going to start refining even the way we administer it, maybe with other drugs, and even get better results. But right now it's fabulous. It's so gratifying to see patients do so well and be so excited about their treatment. It's only going to get better. This is just the beginning. I think we'll use different meds alongside this drug with their concurrent therapy with their therapists, what have you. These doctors and therapists will come together and really be able to manage the patients a lot more effectively.
I love this. It's truly going to change a lot of lives. So quickly, I'm going to mention Hurricane Harvey flooded, of course, the coast, Corpus Christi, and the surrounding areas. You actually have offices down there. Where your office is affected?
The offices are okay, but we're 100% about the community. So we have a charity drive to accept toys to donate to the shelters for kids. So it's Kalypso for Kids. We're trying to help out as much as we can.
Yeah.
Doctors, thank you so much for coming on. Really, really good information. If maybe you have some more questions we didn't cover here, here's the number to call. It's 800-RESET-20, or go to KalypsoWellness.com for more information on Kalypso Wellness Centers. They also have a new Dallas office on Walnut Hill Lane.